Welcome to the Insurance Producers Guild, delivering intelligence for independent agents to help you stay ahead of the trends shaping Medicare, ACA, life insurance, and the broader insurance market landscape. Let's get started.
Picture the scenario for a second.
Okay.
The holidays are over, right? The new year has just started, and your phone rings.
Oh, man. I know where this is going.
Yeah. It is one of your longest-standing Medicare Advantage clients. They are standing at the pharmacy counter, or, maybe they're sitting in their doctor's waiting room.
Right.
And they are completely panicked because they've just been told their coverage does not exist anymore.
Yeah.
Their plan simply vanished on January 1st.
It is the ultimate nightmare scenario.
It really is.
You're caught completely off guard. The client is, well, they're justifiably upset, and you look like you were asleep at the wheel.
Yeah, you look terrible.
Right. You spend years building trust with a client only to have it just evaporate in a single phone call because you weren't prepared for a market shift.
Exactly. And look, the fear of that specific phone call is what keeps agents awake at night right now.
Oh, absolutely.
But we have actual data today, which means we can completely dissolve that anxiety.
We can.
The news about the 2027 plan exits is out in the open. It is a public fact now.
Yeah, it's not a rumor anymore.
Right. During their second quarter earnings call, and this was on July 29, 2026, Humana confirmed a major shift.
A massive shift.
So according to reports from Becker's Payer Issues and Forbes Advisor, Humana expects their 2027 Medicare Advantage plan exits to affect approximately 600,000 members.
Wow. Yeah, 600,000 members is a massive footprint.
It is.
But, instead of panicking over the sheer size of that number, we really need to understand the mechanics behind it.
Right. Break it down.
Because this is not some random corporate retreat. This is a highly calculated margin recovery strategy.
Okay, a margin recovery strategy.
Yeah. The catalyst for all of this is the 2.48% average Medicare Advantage rate increase that CMS finalized back in April.
Right. I want to stop you right there, though.
Sure.
Because throwing around a percentage, like 2.48%, it can sound incredibly abstract to someone who is just out there trying to serve their clients. How does a 2.48% rate increase translate directly into 600,000 people losing their specific health plan?
Yeah, it's a good question.
Walk us through the actual, the mechanical process of how that happens.
Well, we have to look at the medical loss ratio.
The MLR.
Right, the MLR. By law, Medicare Advantage carriers are required to spend a specific percentage of their premium revenue on actual patient care.
Okay.
The remainder goes toward, administrative costs and their profit margin.
Right.
So if CMS only provides a 2.48% increase in base funding, but the real-world cost of healthcare is rising by, say, 6 or 7%.
Which it is.
Exactly, due to inflation and higher utilization, then the math completely breaks down.
Oh, I see.
Hospital stays cost more. Prescription drugs cost more. Specialist visits cost more.
So basically, the carrier is taking in a tiny bit of extra money from the government, but they're paying out significantly more for the care itself.
You got it.
So that margin gets entirely squeezed out.
Well, the margin doesn't just get squeezed. In certain geographic areas, it vanishes completely.
Wow.
And carriers cannot operate at a permanent deficit. They just can't.
Right, they're businesses.
Exactly. They are forced to look at their national map and identify which plans and which counties are bleeding money.
So they have to make cuts.
They either have to drastically cut benefits, raise client copays, or exit those unprofitable counties entirely.
And that's what we're seeing here.
Yeah. Humana is choosing to exit the plans that are dragging down their overall profitability. And notably, most of these exiting plans are rated 3.5 stars or lower for the 2027 bonus year.
Oh, okay. So they are actively trimming the lower tail of profitability.
Yes.
You hear a lot about value-based care in these earnings calls. How does that factor into which counties a carrier keeps and which ones they abandon?
That is the other half of the margin equation right there.
Okay.
In a value-based care model, providers are paid based on patient health outcomes, rather than just getting a fee for every single service they provide.
Right. Fee-for-service is the old way.
Exactly. This value-based model inherently controls costs better. It keeps patients healthier and keeps the carrier's MLR in a sustainable zone.
Okay, that makes sense.
Therefore, carriers are aggressively keeping their footprint in areas with high value-based care penetration.
And dropping the rest.
Conversely, Yes, they are dropping plans in areas that rely heavily on traditional fee-for-service models, where costs are just spiraling out of control.
Right. Okay. So that makes total sense from a corporate balance sheet perspective. But let's look at the human element here. The actual people enrolled in these plans.
The 600,000.
Right. Humana's chief financial officer, Celeste Mellett, noted on that earnings call that the company aims to recapture a significant portion of this volume.
Yes, they did say that.
They want to mirror what they did back in 2025. Their recapture target is just over 40%.
Right.
So if we do the math, 40% of 600,000 members means they are hoping about 240,000 people will simply slide into other Humana plans.
That is their stated goal for the upcoming annual election period, yes.
I got to challenge that framing right away, though.
Okay, why is that?
Because it can be dangerously misleading for an agent working in the field.
Oh, I see what you mean.
An agent might hear that 240,000 figure and treat it as a guaranteed safe zone for a large portion of their book.
Right.
But a corporate target is not a promise to a patient.
No, it is absolutely not.
It reminds me of a giant game of musical chairs.
Okay, I like that analogy.
The carrier owns the room, right? But they just removed 60% of the chairs.
Yeah.
They are projecting that 40% of the people will sit down in the remaining chairs they still own. But when the music stops, every single person in that room is scrambling.
Exactly.
No one is guaranteed a seat.
That is a much better way to visualize the reality on the ground. The recapture rate is, well, it's a financial projection designed to come for Wall Street investors.
Right. It's for the shareholders.
It is not an automatic transfer for any single enrollee on your book of business. Every single affected member, all 600,000 of them, needs a 2027 coverage decision.
Every single one.
Every one. The leftover shopper pool is not just the 360,000 people who will not be recaptured. Everyone is in motion.
Everyone is in motion, which means we have a massive logistical challenge ahead of us.
Huge.
Because we know the 600,000 number, but the exact county-by-county plan names are not public yet.
Right, and that's the sticking point for a lot of people.
I can already hear the frustration from agents asking how they're supposed to prepare when they do not even know which specific plans are on the chopping block.
Look, you do not let the lack of public plan names paralyze you.
Okay.
We have to view this in the context of the last few years. This follows a very clear multi-year retrenchment pattern.
Right. We've seen this movie before.
We really have. Think back to 2025. Humana already shed roughly 500,000 members during that cycle when they exited unprofitable plans.
Yep, I remember that.
Then, for 2026, they narrowed their national footprint down to 46 states and covered 85% of U.S. counties, which was a drop from 89% the year prior.
So this is year 3 of a sustained strategy.
Exactly.
This isn't a sudden shock to the system if you have been paying attention to the macro trends.
Right.
So since we know the event is happening, this becomes a list management problem, not a rumor problem.
That's a great way to put it, a list management problem.
We have to master the timeline to keep clients calm between now and October.
Yes.
So what is the regulatory clock we are working against right now?
Well, we need to look at the strict calendar aligned with CMS. The Integrated Care Resource Center lays this out clearly.
Okay.
The most critical date approaching is September 30, 2026.
September 30.
September 30 is the absolute regulatory deadline for all Medicare Advantage organizations to send the standardized annual notice of change to enrollees.
The ANOC letter.
The ANOC.
That is the trigger point.
Yes, it is. And this applies across the board. It includes dual eligible special needs plans or DSMPs.
Okay, good to know.
Furthermore, plans that have Part D cost sharing must also include the low-income subsidy rider by that exact same date.
So they are all hitting mailboxes at the same time.
All of them.
Think about what happens in a senior's home when that thick envelope arrives.
Right.
It is full of confusing legalese. They read the word terminating and they immediately panic.
Oh, absolutely.
If they have not heard from you first, you have already lost control of the narrative.
100%.
But here is a hard rule for the field, something every agent needs to commit to memory right now. You must not quote a 2027 plan that you cannot visibly show on the public landscape.
No, you absolutely cannot do that. The public landscape typically drops in mid to late September once the offerings are fully finalized by CMS.
Right.
Until that moment, everything is speculative.
You cannot sell what you cannot see. If the landscape has not dropped, you do not quote it. You also cannot promise the client they will land in another Humana plan because, as we established with the musical chairs analogy, we do not know who gets a seat yet.
Right. Maintaining that professional discipline is vital for compliance. And honestly, for client trust.
Yeah.
Frame this entirely as an opportunity to review the client's total healthcare picture.
I love that.
Their doctors might have changed over the last year. Their prescriptions might have changed.
It's a holistic review.
Right.
Right.
This is a moment to reassess everything, not just slap a temporary fix on a terminating plan.
So true. And since we know that ANOC letter is landing in about 30 days, agents cannot wait until October to react.
No.
The annual election period opens October 15th. But if you wait until then, you are already behind the curve.
Way behind.
So let's talk about the literal first thing an agent needs to do tomorrow morning to turn this disruption into a measurable advantage.
Well, it starts with proactive communication. You need to reach out to your clients before the panic sets in.
Yes.
You want to be the calm voice of authority guiding them through the transition.
Exactly. And I'm going to give you the field-tested, word-for-word script to use immediately.
Let's hear it.
When you reach out to your clients this week, this is exactly what you say. Quote, "Some Humana plans are leaving for 2027. I do not have the county-by-county list yet. Your change letter is due by September 30. Let's put 20 minutes on the calendar that week so we read it together before AEP." End quote.
I got to say, the psychology behind that script is incredibly sound.
It works. It really does.
First, you acknowledge the elephant in the room by stating some plans are leaving. You aren't hiding from the reality of the market or pretending everything's fine.
Right, you're being honest.
Second, you establish instant credibility by admitting you do not have the specific list yet.
Which is the truth.
That prevents them from demanding answers you cannot legally or factually provide right now.
Exactly. You are setting the boundaries of the conversation before they can spin out into hypotheticals about what their neighbor heard on the news.
You are containing the anxiety.
Yeah.
Then you point to the September 30 deadline, proving you understand the regulatory system better than they do.
Which builds trust.
And finally, you offer a concrete solution before the annual election period even begins. You anchor yourself as the proactive authority in their life.
Yeah.
You're not just a salesperson, you are their advisor.
You are the advisor. And so the immediate operational directive is clear here. Pull every single Humana Medicare Advantage client on your book today. Go into your system and tag them as priority reviews. But, and this is a big but, sending out mass communication in this highly regulated industry requires a lot of caution.
Oh, yes, it does.
You cannot just blast out a hastily typed email from your personal account.
No, compliance is non-negotiable. The CMS rules on marketing and client communication are stricter than ever.
They really are.
You want to move fast, but a compliance violation will cost you far more than a lost client. It can cost you your license.
And this is where you lean on your verified operational tools. You need to utilize the PSM Marketing Hub.
That's a huge resource.
It is. They provide co-branded review letters specifically designed for these types of market events.
Right.
So you generate a professional, authoritative letter to send to that tag list. But before a single letter goes in the mail or a single email hits an inbox, you must send that draft to the PSM Compliance and Legal Department.
Yes. They will review and clear the marketing language so you are totally protected.
You have to protect yourself.
Speed is important, but accuracy is what keeps your business running long term.
Build the collateral in the PSM Marketing Hub, get it cleared by the Compliance and Legal Department, and deploy it.
That's the workflow.
Once the communication strategy is locked in, we have to look at the broader logistical hurdle. If Humana hits their 40% recapture target, that leaves roughly 360,000 members nationwide who will definitely need a completely different carrier or a return to original Medicare.
That is a massive influx of shoppers entering the market simultaneously.
Massive.
Your portfolio has to be robust enough to handle them. If you only have one or two carrier contracts in a specific county, and those happen to be the ones exiting or reducing benefits, well, you have nowhere to move your clients.
And what happens then?
They will find another agent who has the right products.
Which means agents must lean on PSM contracting support today.
Right now.
Do not wait until October 10 to realize you are missing a key regional carrier. Make sure all of your 2027 appointments are active, certified, and ready to go well before AEP opens.
Exactly.
You cannot solve a client's problem in November if you do not have the right carrier contracts in place in August.
No, we can't.
And for agents who are looking to actively grow their book during this chaos, leaning on PSM lead vendor partnerships or PSM business coaching can help you scale your outreach to capture those displaced shoppers.
Absolutely. And, this Humana exit is a massive event on its own, but we really have to pull back and look at the macro environment. Humana is not operating in a vacuum.
Wait, this is the most critical piece of the puzzle that I think a lot of people are overlooking right now.
Yeah.
If Humana is cutting 600,000 members just to survive a 2.48% rate increase, what does that mean for the rest of the market? Every single carrier is looking at that exact same CMS rate.
Exactly. Every competing carrier is evaluating their own medical loss ratios, their own administrative costs, and their own profitability under those same tight rate conditions.
So they're all feeling the squeeze.
Yes. The disruption is going to ripple across the entire industry. Other carriers will inevitably adjust their own footprints, tweak their benefits, or exit unprofitable counties.
So this is not just a Humana event. The Humana news is just the first domino to fall.
It is the catalyst. This creates a massive industry-wide review opportunity for an agent's entire book of business. The strategy we just outlined does not just apply to your Humana clients.
Right.
Every single client needs a comprehensive review because the ground is shifting underneath all of them.
That changes the entire scope of AEP. You use the Humana news as the spearhead to open conversations, but you apply that proactive review strategy across your entire book. You protect the clients you have, and you position yourself to catch the clients who are left behind by unprepared agents. That's this episode of the Insurance Producers Guild. Stay tuned for the next one. If you're not already with PSM Brokerage, this is the intelligence our agents get. Talk to us about contracting.